Does Kybella work? Countless people are afflicted with the dreaded double chin. So much so that proposing an easy fix can easily attract a person to try it. Some are willing to pay anything to have that sharper neckline and flatten that double chin. When someone talks to you, it's hard for them not to notice that you have a double chin. At some point, you just want to be rid of it and find the simplest, least expensive way to do so. So maybe you're getting a massage at a spa or having a mole looked at by your dermatologist. The esthetician or doctor might casually ask if you've ever been bothered by the chubbiness under your chin. Of course you're bothered by it. No matter how much you try, you can't seem to get that area to flatten out. You've lost 15 pounds working out and dieting, and it's still there. You say that the only thing is that you don't want expensive surgery where you have to be asleep. Now they say, well, this is your lucky day. It just so happens that I can give you a quick injection which will totally flatten it out. You'll be swollen for a few days and don't have to wear a compression garment. Takes a couple of minutes to do, and bye-bye double chin. Well, read some reviews and experiences of people who have had Kybella. You'll see plenty of people who complain that it's painful, has massive swelling that lasts weeks, gives minimal results, and has to be repeated. And by the way, it's pretty expensive. How is Kybella given? Kybella is a liquid that's injected under the skin in predetermined areas. A template is used to mark the injection sites. Because Kybella is an acid, it burns as it's injected, and for many people, it continues to burn for a while afterward. After that, you just wait to see what happens. So why do so many people have Kybella treatments? They have unlimited resources to market Kybella, and that marketing draws in millions of people. What is Kybella? Kybella contains something called deoxycholic acid. Yes, it is an acid being injected under your skin. Deoxycholic acid isn't anything gross, it's just a bile acid. That's the stuff your liver produces to help digest food. Deoxycholic acid works in this setting by injuring the cell membranes of fat cells. The fat then leaks out under the skin and is absorbed by your body. With the fat cells gone, the size of your double chin is supposed to decrease. The concept of injecting medications or enzymes under the skin to be absorbed is nothing new. It's been around since the 50s and used for dissolving fat for decades. It kind of went away because it doesn't work that well. Now someone started promoting it as a new idea and marketing it through a major corporation, and it sounds new and exciting. It's promoted as an alternative to surgery, which many people want to avoid. Kybella is a great example of too good to be true. If something so simple could provide consistently great results, no one would ever have surgery. Well, I don't use Kybella in my practice. I exclusively do surgical treatments. I don't say that Kybella doesn't work well because I want to do surgery. I do surgery because Kybella doesn't work well. Using liposuction to treat a double chin offers a lot of advantages. For one thing, it actually takes fat cells out of the area being treated. There's no question the area will be smaller if the fat is gone. Kybella injures the fat cells only in the area where the needle is inserted, but not all of the fat cells are eliminated. The other advantage is that the area can be precisely shaped with liposuction. I use a very small cannula to remove fat from specific places, and I remove less in some areas than in others to produce that desired shape. The contour I'm trying to achieve is decided on with the patient so that they get the look they really want. Injecting Kybella into the same sites on every patient can't possibly produce the contours that all patients want. I do double chin liposuction exclusively with local anesthesia, which means there's no need to be asleep. I mix the anesthetic solution in a way that makes it easy to inject without hurting you. After a few minutes, the area is completely numb and the procedure can be done without pain, as opposed to the significant pain you can experience with a Kybella. The cost of having a surgical procedure is usually higher than a treatment with Kybella. The thing to keep in mind is that I've seen patients who have had 6 Kybella treatments or more with little improvement. While the cost of a single treatment might seem reasonable, it adds up when you have multiple treatments. Even a few $100s is too much for minimal change. Because liposuction can be done gently, there's actually no serious trauma to the skin or subcutaneous structures. That means only modest swelling, which resolves quickly. There are fewer hard spots under the chin, which are often seen with Kybella treatments. Kybella is only used in the area just behind the chin. There isn't a lot of room to adjust the treatments for different patients. With liposuction, on the other hand, shaping can also go around the jawline, behind the angle of the jaw, onto the jowls and cheeks, and different amounts of fat can be taken from all of these areas. Liposuction for a double chin only requires one treatment. That means one period of post-op swelling as opposed to the massive and long-term swelling that patients have to endure after each Kybella treatment. You don't have to worry about being out of work for a week or two every other month. The most important advantage of liposuction surgery is that it works. It removes the fat and allows precise shaping. When you compare methods to treat a double chin, look at all the factors I just described. If you really think hard about what you're spending and what you're getting, it's pretty clear that nothing compares with liposuction for treating a double chin and even shaping the entire lower portion of your face.